just to set up.
I forgot to record you. So I'm going to ask if you could just stick this in your pocket. You are being recorded.
Oh, okay.
Just put that on you. Thank you. Thank
All
you,
right.
Ronnie.
Maybe, could it hear me over there or wasn't? Oh, okay. All right, we can go to the next one. It's okay when you remember it, so. We can go to the next slide. Okay, so the baby's temperament. What happens if you have a baby that has colic? Anybody have a baby that had colic? Oh my goodness, okay. And anybody that had a baby with a shrill cry? Okay, and you're in the hospital and you know your baby is the one with the shrill cry and everybody's holding their ears and you're like, oh my God. And it's worse for you to listen to that baby, and then you're going to be taking that baby home, and sometimes there's a mismatch with the temperament. So if you're very quiet and the baby's very verbal, that can be really difficult. But on the other hand, there are moms that are very verbal and their babies are very quiet and they really worry about them because they don't act normally. Why aren't you noisier? Okay. My parents told me that I was a very quiet baby, and it really disturbed them because, and I would be looking around, but they didn't understand why I wasn't crying like the rest of the babies. So you can have on both ends. So some moms are worried if they have enough breast milk, and that's sort of like a measure of their competence. They feel that if they can't breastfeed, they've really failed. And sometimes that can be something that can be such a stressor for moms. And they're embarrassed to tell other people if, oh my God, I don't have enough breast milk. The other thing with my patient that ended up with a psychosis, she was on medication. They advised her not to breastfeed. And so how is she going to explain to other people that she's not breastfeeding? Why isn't she breastfeeding? And she didn't want to answer those questions. So oftentimes partners, they can have the most lovely, wonderful husband in the world. But it's really, really hard sometimes for them to understand what women are going through after they have a baby. They try, but it's like before you have a baby, how much do you understand what that's like? And then finally when you do, it's like, oh, this is what she was going through. And so men can't do that, so we have to help them to really understand. And that's some of the things that I do in couples therapy with couples, just to really, there's not just an attachment with the baby, because we always think about attachment with the baby. We need to be attached for the rest of our lives until the day that we die, just like babies do. And who do we transfer that attachment to? So when we're babies and when we're children, we're attached to our parents. And then when we get married, we attach to our partners. And we expect that our partners are going to be able to hold us in times of trouble. So it's really important that the partner does understand and tries to help. And there's a change in relationship with the partner. What happens now when the couple tries to be intimate and the baby cries? How do they reconnect with their intimacy? And then, yes?
Yeah, I was saying on a very basic, also physical level, if a woman who is postpartum doesn't feel very sexual, doesn't feel, feminine in that way. They might feel very maternal, but not necessarily feminine.
Right.
And
Very
also
different things.
Very different.
Yeah.
And that struggle that can present to a couple.
Right. Yeah, so it can take a long time before women actually feel that they want to be intimate again. It's very hard for them. So they worry about their marriage. Their communication's not good. They worry if their partner actually accepts the baby. Some men are jealous. They don't want to say that, but, they want to be intimate, and then you have a baby that's breastfeeding. And so how do you juggle those things? So these are some of those other stressors. And then I put in there the sexuality and niddah, particularly for you guys. If I went to another venue to talk about it, they may not know what niddah is, but this is another stressor that people have. I like this picture because this is what women kind of do. They really try to juggle things. One of the things that's really hard, and I think it was hard in Lakewood, and you could speak to your community as well. By the way, if I say anything and you want to just say something, I don't have to stick to everything that we're doing here. I'd really like to hear from you as well, thoughts or feelings that you have about any of this. So when people don't have support, or their support has to go back to work, or they can't be available. And I've also dealt with people who a mother has died and they don't have that mother. Usually the two things that really send people to depression or anxiety is two things that I see is the relationship with their own mom is really important, and the relationship with their partner. Those are like the really key ones. And if mom's not on board, then that can be really hard. I had a patient that had an emergency C-section for a face presentation. It wasn't deliverable. And she had to be crashed under anesthesia, which was very traumatic for her. And then when she woke up, her mother was holding her baby and saying, "I'm so much better at this than you are." That was the first words that she heard. So this woman, needless to say, that really gave me the picture of what her relationship was like with her mother. She spiraled down into an incredible depression, really awful. And so one of the interventions that we had to do, which I almost never do, is I said, "I think you need a break from your mother until you feel better with your baby." And, tried to talk to her husband to try to get him on board. He did not believe in psychiatry, would not let her have medication or anything, but he would let a doula in. So what we did is there was a doula that was trained by a psychiatrist, and so she really became the therapist and helped her navigate. So she had an unsupportive husband who was not really seeing that she was mentally ill, and she had this mother who just said this really awful thing for her first baby. So, okay, so the other thing is that we're taught that becoming a mother is instinctual. It's a maternal instinct, just like animals, and we know exactly what to do. So as soon as you have a baby, you know exactly what it is you're supposed to do, right? Yeah, you're supposed to be able to just get it intuitively. How many of you felt intuitive? How many of you needed instructions? Like, what do I do next? How do I play with my baby? How do I navigate these things? We have like this whole system here that comes with, big instruction book, and we don't get that. Why not? And, the other thing is I think in our society that we can be so isolated, women can be so isolated, and if their parents live somewhere else, it's really difficult to figure out how to do. So not other stressors. The house is a mess. So here's a lady who cleaned her house for me, and I was just like, no, you don't do that. I expect that your house is going to be a mess. And I learned after that I needed to tell moms that I'm going to be coming to your house on the 3rd day postpartum. And if your house is immaculate, I'm going to yell at you. So I said, it's not normal to have an immaculate house, unless you, I guess, are very wealthy and you have, people that are helping you or whatever. But if you're doing the cleaning, you really shouldn't be doing the cleaning at that point. There's no time to make healthy meals. Worrying about other children. I think that you had mentioned about, that other children may feel that they are not getting attention. That moms need adult contact. That sometimes they're so surrounded by children that it's really difficult sometimes. Not enough time, somebody had mentioned enough time for yourself. Is that, did you had mentioned that? Yeah. And then negative feelings, and I think you had mentioned that about their body and their weight, that they feel maternal, but they don't feel feminine. So we can go to the next one. Trying to be mindful of your time as well. So we talked about poor family of origin relationships with mom, unrealistic expectations that they need to be perfect, that you can't go to the bathroom, have time to take a shower. I think I remember that with my kids, that I just wanted to go to the bathroom, just for a minute by myself.
Close the door.
Yes, and there was no closed doors for a long time. When do you return to work? For women who are returning to work, how do they make that decision? And then there's financial stress as well, like I need to go back to work. And then there may be other things that are happening in their lives that we just can't predict what's going to happen. Okay. So I'm going to start this, and then if you wanted to take that break at 5 after, This theory about being a new mom, I think, will be a really wonderful guideline for you. Riva Rubin, she was a nurse, and she came up with this theory about becoming a mother. And unfortunately, I think she may have died of breast cancer like way too early. So she didn't finish, but other people like Ramona Mercer and some other people helped her finish this theory. But she was a nurse researcher, and it's important because it could really help to guide you for when when you would be most helpful for mom and how you could be most helpful. So anything more on the stressors, because I'm kind of leaving the stressors. Anything else that you guys wanted to say?
I think there's another stressor that we didn't mention, and I think it's as you have more kids, at least for me, I felt more of a push to get myself back in gear. Because it's like when you have just one kid, it's like you have flexibility of like doing things, staying at home all day. But when you have 2 or 3 or 4 or more, it's like, well, you still have to pick up the kids from school, and like there's just like
It doesn't stop.
Right.
Yeah.
And there's other children who are depending on you to like be your normal self. And I think like that's also something that we kind of forget about. Like with the first baby, like, oh, let me help you, you don't know what to do. But like you really need more help when you have more kids also to just balance that. So I don't know, I felt like I had to totally be like mind over matter. With like my second and third, it's like it's enough resting now.
But it can take
like,
its toll.
Yes.
Yeah.
But like I just felt like enough. And this is enough already, and like you just have to get yourself together because this little one's also needs you, and that one needs you too.
So I think this is why you as Bloom ambassadors are so important, because all of these struggles that women have, that you know what they're going through, and to just say, yeah, this is a really difficult time, and how are you going to manage that, and to talk to them about it. Yeah.
Kind of like what Patty was saying, but a little bit different. I remember after my first was born, and maybe within the first week after she was born, that thinking like, for 9 months you have like this amazing prenatal care, and you're seen by your OBGYN, and like every month, you know, you wouldn't miss a month of not going to the doctor, and in your 9th month even more often. And then I don't think you're allowed to leave. My youngest is 13, so forgive my fuzzy memory. But I don't think you're allowed to leave the hospital without like identifying a pediatrician for your newborn baby.
Mm-hmm.
Right. So your baby has a pediatrician, and then it's like, well, wait, like, what about me?
Exactly. And how many, there's a number of women, a large percentage of women that never go for their postpartum.
Right.
Because they're last. And they really do need it.
I wonder if in other cultures it's different.
It's interesting because I also wrote a paper on other cultures, and there are cultures that actually take over for the mom for about 6 weeks,
Right.
and they do everything for her.
Like in African tribal countries too.
Yeah, and it's pretty amazing, and it really does help them to get back together.
I know there's another culture, I don't remember which one, but the mother is not allowed to leave the home for like months, I
think
want to
it's Saudi
say.
Arabia. I don't know if the or it's like 6 weeks or
A
4 weeks or
long
something like
while.
that. Like I think maybe Saudi Arabia.
And no one's allowed to be near her either. So there's a lot of protectiveness.
I know, like, I grew up in Switzerland, I know they are like, I think it's 2 weeks or 3 weeks after, like, they come, like, the midwife comes like every 3 days, comes to check on the mom and comes to check.
And where was
on
it?
Switzerland.
Switzerland, yeah.
Comes to check on the baby. I think it's for 2
The
weeks or
European
something.
model is so much better than what we have here.
And they also
if,
stay in the hospital for a week.
yeah. So, and we don't do that. I mean, my mother, who's 92 now, she stayed in the hospital for 10 days. And so that really helped women quite a bit with, all the things that they would have been challenged with.
Do you think those Kempitoran places help?
Like the mother baby.
The Aimviyelad kind
Yeah.
of.
Yeah.
Oh, I think they're wonderful. I think they're really wonderful. But again, it's
In Lakewood?
in Lakewood they have Aimviyelad. And it's really wonderful. It costs money, so it's not like insurance covers it. And so if you have somebody who doesn't have so much money, that can be a problem.
But I'll tell you, also in the Hasidic world, it's understood that when a mother has a baby, she goes to her mother's home.
Right.
For typically 2 to 3 weeks at a time. Even if there's other children in the house, and the other children will very often be shuttled out to siblings' houses. that the mother is given that space. She does not come to her own personal home in general. If there is a mother to care for her, she moves into the mother's home.
I think the thing is, because I saw different things.
Right.
So, with this woman who had the psychosis, her mother was too nervous to take her in.
Right. I'm talking about
And
normal
yeah,
circumstances.
right. So I'm just saying that there's the ideal, which is great. Like if you can stay with your mother, and your mother is really, just so loving, and she puts her arms around you and tells you everything's okay. That's wonderful. But there are, of course, many times that there's also women who they don't get it. I mean, even if they love their mother, they may not be able to get along with her so well.
The moms, they're still having babies. Love.
Yeah.
But I love my mom, but I was an only child, and she has no clue. And so when my children are born, my mom's always like, "Let me come see the new baby," and everyone's in your house, but they're not really helping you. You're hosting all these people.
And we're actually going to talk about that. Like, how do you manage that?
Yeah, because it's a whole different.
Also, sometimes when I had my third, some things happened that were not planned. My mother, she was going to be the most amazing mother. She'd be like, "I'm coming. I'm going to take care of your kids. You are just going to stay up in your room and not worry about anything except nursing the new baby." Well, what happened was my mother got sick the same day that I gave birth, and we got a call, and it was on Shabbat. I was at the birth center in Bryn Mawr, and I was told and I didn't know if I should answer the phone or not, and eventually I was like, I'm answering the phone, so I just did, and my mother said she's going to the hospital, and all the other kids were two other kids, they were going to, to their friends, and she walked them to their friends, and I came home to this, eventually they were brought home, my father was there. The whole house was turned upside down, every game, every Lego, the whole time, and I walked in, and I was just and my dad was kind of okay, see ya, baby, cute, gotta go to your mother in the hospital, and, and we'll see you when everything's all better, and I was just my husband and I were just
Well, and you said, was this with the child that you felt a little bit more anxious?
Yeah.
Well, no wonder. Yeah. So, and we don't know what's going to happen. So, you totally are going to rely on your mother. And, the other thing that I've seen happen, I've seen in Lakewood, is that two daughters deliver at the same time. So where does the mom go? And she has to make a decision. And if somebody has, and it seemed also that the more children that they had, the more they were on their own.
Yeah. She already knows.
That's right.
I want to tell one quick funny story. I spoke with Representative Weinberg, Ella Shelton from Baltimore, and I remember talking to her about having a new baby, and she says, I just want to give you one piece of advice. She goes, act incompetent. For at least 2 weeks, don't lift a finger. She goes, I don't care if you're feeling awesome. She goes, do not do a thing.
I don't know what to do.
I don't know how to, I can't get up, I'm not feeling up to it. She goes, do nothing. She goes, don't lift a finger, let your husband step up to the plate, but you act incompetent for at least 2 weeks. It was the best.
And if you're in a very secure household where people help, that's great. But again, if you're in another type of household where it's a little pathological, then you're going to have to step up to the plate. So we try to really help women from where they're at. Okay, so what do you want to do? You want to take a break? Okay, we can do that. And I'll put this on a pause or a...
Yeah, there's a first press that button right there.
The red button?
Yep.
Yes, now it's done. Okay. So I was saying that Reva Rubin came up with this theory, which I think will be really helpful to you. And if you think of it, that the mom is developing into a mom. She has to grow and learn how to be a mom. So there's 3 stages that she talked about. The first one is taking in. The second one is taking hold. And the third is letting go. And it happens after the birth of every single child. It doesn't matter whether you're on number 13, the same process happens for each. So if we can go to the next slide. Thank you. So the first one is taking in. And what she said is that lasts about 3 days. But I think it takes longer for some moms, depending on what their situation is. So the taking in phase is that the mom is really focused on herself. And she needs to do that. So after you have a baby, Moms just crave sleep and rest. If somebody's been up for 3 days before they deliver, they've had a C-section, or even if they've had a normal birth, they just need to rest. How much sleep do you get in the hospital?
Very little.
An hour.
And in a birth center, you're only there for a certain number of hours and then you're
Yeah,
home.
that was a mistake. I was wondering, I wanted my 2 days.
So there are some things, but some people, like, the idea of having 10 days is a kind of a blessing as well. So there's this period where it's, the baby's out and the mom is just really thinking about herself. I think some moms might even feel a little bit selfish at this point, but it's, episiotomy hurting, hemorrhoids hurting, milk coming in, all of these things that really make a mom self-focused. She's not so much focused on the baby. She tends to really be dependent on others, and this is the time that mom can't make decisions. So when you're talking to a mom in this phase, she seems like she's just not together at this point, but that's okay, because it's a normal part of becoming a mom. She needs to talk about the birth experience. How many of you needed to talk about the birth experience?
we still do it, it's 20 years.
Yeah.
It doesn't end.
Exactly. So we need to talk about that. They're in awe that they just had a baby. And then this is also a time that she might feel abandoned because there was so much attention on her as a pregnant person. And then suddenly you have this baby, and now all the attention is going to the baby. And when they have parties, who gets the presents, not really thinking about what the mom needs. But if we help people to understand that mom really needs a lot of help at that point, that's important. And that she might worry about her body image. So this is a time that she's really inward, and it's a normal time. So if somebody has a preemie or they've had some sort of traumatic birth, I think this stage can last much longer than that. Okay. By the way, with those 3 stages, and after you let go, you're supposed to have this maternal identity. By a year postpartum, there's still about 4% of women who have not achieved maternal identity, maybe more. So we need to think about that. What's that?
What does that mean?
Well, I'm going to get into what it means to. So the first part is, this is how we evolve into, or how we grow into becoming a mom, is first in that taking in phase where you just want to focus on your body and what's been happening to you and tell your story.
So you're really not focused on the baby initially? I would.
Not necessarily. It's not a time that the mom has just been through this incredible experience. So I guess what I'm asking is, you have children.
Yes.
And so some moms will be immediately into their babies, but the normal process among, like when she did a study of many women, that this was a time that they were very focused on themselves and not so much on the baby. They nursed, they did what they had to do. They may have been in love with their babies. They're in awe that they had a baby. But the focus is more on their experience, not so much on what the care of the baby is and the things that they need to do. But so this is about 3 days. Again, remember we say that this is a pretty short time. But for other women, this may take longer, because depending on what's happened to them. Unfortunately, I have, in my 2,000 births, so I did 2,000 births, more than 2,000 births, but then there's probably 10,000 that I was either with labor or taking care of them, during pregnancy or something like that. And I would say that feels about right. And a lot of women even don't want to admit that, they are more focused on themselves than they are on their baby. Like that's a selfish thing. But it's not a selfish thing, it's actually a normal thing.
Did you find that some people were like resentful a little bit about the fact that they had to, I definitely was not into my baby right away. I know you're supposed to be like, oh my gosh. I was
Some people were resentful and they felt very guilty.
Right.
So what I'm saying to you,
being afraid of the baby, I don't know what I'm with the first, I don't know what I'm doing type of thing.
so this is a really key point, because the two of you had different experiences, and this is the norm, okay? So I'm just telling you that in terms of her research. So when you're trying to be helpful to moms, you need to put that space there that this mom may not be into her baby at all. She may resent that baby. it's crying, it's the one that's the shrill scream, you know. Maybe the baby doesn't look so good. You know, sometimes when you have a baby, it's not the prettiest thing in the world. You know, it's a face only a mother could love. But, you know, I've seen babies that are born by, you know, with forceps, and they look a little funny. You know, they're not exactly what they expected. Or, you know, somebody's expecting a 7-pound baby and they have a 10-pound baby. You know, and this baby's like a barracuda that wants to nurse all the time. And they do call them barracuda babies, because they can find a breast in any room and latch on, and they're just that's gonna suck that mom dry. And you know, moms are like, oh my God, I have to drink, I have to eat. So there's a lot of self-absorption, and we need to give moms that space. So that's what's really important. So it's wonderful, but when we measure what another woman's experience is by our experience, sometimes it's hard to kind of jump in and validate what she's feeling. So, you know, what I'm saying with you is that, yes, I'm validating that there are women that absolutely resent it. You know, that the attention goes now from here to this baby. Nobody cares about me anymore, as a possibility. Or it's just, you know, it's like the reality of what did I sign up for? So, oh my God.
I think also we have to pay attention to the idea that when a mom's not feeling well, also,
Mhm.
feeling really awful after delivery. I remember feeling with my youngest one, I remember looking at her and just kind of like, I know I'll attach to you, but I'm not ready yet. I remember like baby was in the room, I had no desire to hold her, nothing. I knew it would come, so I wasn't frightened by it, but I really was not feeling well, and I couldn't. I just didn't have the strength or the energy to pay attention to that baby, but it came later.
So my father was a physician, and he said to me, as soon as you have a baby, you're going to know exactly what to do. And it wasn't true. You know, the maternal instinct. So anyway, this is what Riva Rubin, she interviewed lots and lots of women, and this is what she found. Okay, so we can go to the next one. The next phase is taking hold. So this is, you know, on average about 3 to 10 days postpartum. But remember, in 1967, women were not working. So we have a different world, and so maybe the length of these things. But again, you know, when you're talking to a mom, get an idea of where she is, so that you don't have to say you're in the taking in phase. Maybe that would be helpful. But just that you know that this is a time that really she can only talk about her experience, and she needs you to listen to her. So now she starts to focus on the infant and attachment. And it's no accident that this is also the time that the milk comes in as well, right? Around 3 days postpartum. She focuses on her self-care, her bowels, her bladder, her breastfeeding. She's very open to advice at this point. So where before she's very self-absorbed, now she wants to listen to what you have to say. She can make decisions right now. She still may feel that she can't trust her own instincts, but she's open to your advice. She worries that she might not do things that are right for this baby, and she needs reassurance. And again, she's worrying whether her partner's accepting the baby as well, because here she's trying to juggle, you know. And then, you know, I'm thinking about nida as well, not being able to hold your partner. Okay, so
I have a question about those. Can you just go back to the previous one?
the taking in.
So someone who's had, this is not for I could see that this would be for the first baby, but it makes me wonder, like, worries may not do right things for the baby's growth, but we've had experience with the first child. This could be the second, the ninth, or whatever, and trusting our own instincts. Well, we already had a child before, so does this apply also for?
So suppose somebody has a special needs child, or suppose they had a girl the first time and they have a boy this time. You know, each child is different. Then there may be some trusting instincts about how you're going to incorporate that baby into the family and have it accepted. So there may be different things that you think of. You know, these are more focused on the first-time moms, but they say that this process still happens with every baby that you have. You know, that there's still this taking in phase, and there's still that taking hold phase, and that it's okay to go through those phases. So, you know, these are kind of examples. They may not hit every single point. Maybe they feel that their instinct is better. The other thing, though, I'm thinking about a woman that I had in Lakewood who was having her 6th baby. And for 5 of the babies, she was profoundly depressed. And for this one, I convinced her to take medication during the pregnancy. It was the first birth that she actually remembered. And then it was like, what do I do now? Because it was like a first. So we don't know. So I'm just giving you this kind of guideline so that you look and say, okay, well, this is time that mom's going to be really receptive to me. There may be things that she doesn't feel confident about. Whatever it is, it might be personal to her, but there's still that idea that different people come up with different stories, and we just have to tune into what's going on with them.
I think also, depending on what has happened in this woman's life in the past several weeks or months, I've seen where women have gone through let's say a loss. So they've lost a parent or a family member's ill. So that it can be so disorienting to them. But even though a year or 2 years ago, they were extremely confident about being a mother, right now they're not confident about anything. Or if they're struggling with another child's behavior or relationship, or a kid is challenging them significantly. So then you can, even if it's not a mental illness issue, but it's just a matter of kind of questioning, I'm not sure I do have this, even if it's my 7th child. So I think that depending on what the circumstances are, there could be, I can see how these could be applied.
Or they may have moved across the country. And so for their first 2 kids, they may have had tremendous support. And now they're in a different city. And so that kind of disorients them, or different culture.
Also, I think like husbands are very involved in like the first birth or 2, and at least my experience wasn't that he totally lost interest, but I was always like with my 3rd, I was like, you're not asking those same questions you were before. You're not as interested in this. So I mean, I definitely felt a little bit like I was trying to pull him into it, like come back.
So this becomes this.
Don't you think she's cute?
This becomes new territory.
Even during the pregnancy. I was like,
So this becomes new territory again.
Right.
So where you understood your husband for the first 2 births, then, and then the 3rd one, something else different happens. And I think you had brought up a point also about how the 3rd birth was so different from the other 2. That the circumstances were different. And so we just have to think that things are constantly evolving. It's not going to be the same every single time. Okay, so letting go, they say, is about 10 days to 6 weeks postpartum, but again, could take longer for some moms. And now they feel that the baby is a separate person from them. They give up the fantasy baby. How many people had fantasy babies that you...
What does that mean?
A fantasy baby, you imagine that your baby is going to have big cheeks and be gorgeous, and it's not going to cry, and you're going to go to places, and you're just going to be like the model, like a model with the model baby.
Before any of us had our first, we probably thought it was going to be awesome and perfect, and then you have the baby. I don't think by number 2 or 3 you're thinking that.
Yeah.
4 or 5 or 9.
Right.
But I think before you're first, you're this young couple, and this is going to be so awesome. We're going to play house, and it's going to be so much fun.
And I'm going to do this so much better than anybody else that I've ever seen. So.
Like an accessory almost.
Yeah. Right, exactly.
Like a new toy.
That's exactly it. But the baby does have a mind of its own, for sure. Actually, it's funny because my daughter's name is Amanda, and I think when I brought her home, she had a personality. It was a very strong personality. And my brother-in-law renamed her Demanda. At 4 days postpartum. It's like, how does that, because she wanted what she wanted when she wanted it. And at 34, she's still the same way. So now she's a social worker and she takes care of a lot of people, but this is good for her. So she can't demand so much. Lots of people demand from her now. Okay, so this is a time that moms are adjusted, they've defined their role, and they've reformed their bonds with their partner, and they feel really confident. Okay, so let's go to the next slide. So these are the kind of things that moms need to do in order to grow into a new mom. One is replication, so they need to model. So you can be wonderful models for them about how to hold their baby. We have a program where we teach moms about the cues of their baby. Because again, babies don't come with instructions and you have to let them know. So you show them a way to hold their baby or a way to be with their baby or a way to soothe their baby, they're going to mimic you. And so you're going to be an amazing model for them. They also have fantasy, and we'll talk about each one of these: introjection, projection, and acceptance and rejection. There's getting the identity, and then they also have to grieve what didn't happen. Okay, so let's go to the next. Okay, so this is a time that moms really look for other moms to show them what to do. They want to imitate it. They want to act out being a new mom, and they might be really afraid to make mistakes. And this is where you come in to tell them that they need your permission to try out this new role. So try it, see what happens. Like, I didn't do that with mine, but let's see how this works, and maybe this will work better than what I figured out. So they need some encouragement, but they want to watch what you're doing. And this happens, again, in that, more in that taking hold phase. Again, they're going to watch that more. They may watch you somewhat when they're in the taking in phase, but really in the taking hold, because they're more interested in what they need to do. We can go to the next slide. So then she also moves to a stage where she does fantasy. So she imagines her new role rather than acting out. How many of you had dreams, fantasies after you had a baby? Do you remember anything like that? Okay. So this is...
Baby was crying.
Yeah. So, what are, just, you imagine kind of fears and dreams and that sort of thing. And we can go to the next one. So the stage before that is kind of, and it doesn't have to be linear. This can kind of go back and forth. But it's just kind of interesting to think about these things. And I can send these slides to Devora if you wanted to, have them for yourself, just to remember some of these things. So, you imagine doing things as a mom, and then you decide whether this is right for me or not right for me. So you might watch another mom do it and say, I'm not really sure that I want to do it that way. But that's kind of interesting. If it's a good fit, she's going to accept the behavior. If it's not a good fit, she's going to reject it. So just understand that she needs to go through that process where she decides what's right for her. Have any of you seen other moms do things and you say, oh, I like what she's doing, or I don't like what she's doing?
But where does this interact with social media? Because I think what we're seeing a lot of is a lot of this stuff is happening online.
Mm-hmm.
Where the mother will post a suggestion, a request, information, and then everybody's responding with their advice, ideas, and
yeah, we just have to be careful of that because of the information that they may get. So, to try this or that. Uh-oh.
It's fine.
Okay. So, yeah. So that's like
I think of it like it's a new phenomenon.
It's a new territory.
What do you say?
Happens a lot.
Happens constantly, and I think about how maybe the mom doesn't necessarily how this component of the theory is shifting a little bit, and that it's not necessarily a one-on-one from perhaps a trusted adult friend or community member.
Right.
It's everybody's throwing their advice at you, and I imagine there'd be a little bit of like.
It's interesting because when I was in Lakewood, hardly any of the women had any computers or anything like that. So that's like a different kind of community. But in social media, that could be different. But again, maybe she'll watch a YouTube of something. So she's going to try to imitate something that she could get on social media and then decide whether that's right for her or not.
But are you saying that's a good thing or
No, not a good thing.
Uh-huh.
And not necessarily a good thing as much as I think it's a challenge. It can be overwhelming. I think that process of, is this a good fit? She'll accept the behavior. If it's not a good fit, she'll reject it. She's getting so many different ideas at one time. I think it can be extremely overwhelming to synthesize. Like,
I had that not in the social media realm, but I had like everyone giving me advice with my first. It was right before Pesach, and we were all together. My in-laws, my parents, aunts, uncles, and it was the first grandchild on both sides, and 25 people were like, she's crying because of this, and she's crying because, I'm like, oh my God, there's so many different things to worry about.
Yeah.
right.
The other is having that baby passed around to all the relatives as well.
There's a big difference between like a personal connection though, and like, I have no experience with having given birth and like going on Facebook because I wasn't even on Facebook the last time I gave birth. But I can't even imagine if I was a new mother and I was just, I was I don't know, just, okay, I'm gonna go online now because I'm bored, and like a million things coming at me
This is
about
when
like,
moms-
how to be a mother.
This is when moms text me. They can't talk to me on the phone, but they're breastfeeding and texting at the same time. So it's mind-boggling.
Like Facebook also gives you a really, talk about fantasy, Facebook gives you false representation constantly.
Well, all media does. It's like saying
Yeah.
that the sex you see on TV is real sex. Like anything you see on TV is kind of.
And people that you like
Well, you
trust
think
and
you
you
know.
think, right,
You
you
think,
think
you don't know
you
that.
think they're
Yeah.
giving you like a real, like you see the person who gives birth before you and you're like, oh wow, this is what it's gonna be like, because that's what it looks like for like your friend who you know well in real life, but Facebook makes it like, or whatever social media makes it, like that contributes to the fantasy as well.
I wonder if it just amplifies what's out there anyway. So even before
For sure.
Facebook, there's a million people, like you said, that interfere, or if they try, they're meaning well and they're trying to give you advice, but now they're on Facebook. So, but it would be interesting to see how it evolves. And I think that you're right, that so much information is coming at us. You know, when I started teaching at Drexel in 2008, and that was doing it in face-to-face, all of my students now are online, and I hate it. Because there's so much that we take in a sensory way that's not the same. And what I worry about is like the new nurses coming up, that all they're going to know is that way of doing thing, where there's not that personal touch that I think that people still need. So we can go to the next. Okay, so when she achieves her identity, she really feels that she is a mom. You know, it's interesting because when I would see moms come for their postpartum checkup, like 4 to 6 weeks, you know, like before then, maybe when I saw them, I might see them at 2 weeks. They weren't quite together. But at 6 weeks, they've got the bag down, they've got the stroller, they know exactly what to do, they know what that cry is supposed to be for. And that's what we're really trying to get moms, not necessarily that they don't get stressed out, but that they can anticipate what their baby needs. You know, we're not going to say it's perfect, but they feel comfortable that they're capable of doing this. They learn about themselves in the relationship to partner, and this evolves as the baby changes and grows older. Somebody was talking about little kids, so it's like little kids, little problems, big kids, big problems. And it's, you know, not to be scary, but it's just that things get more complicated as they get older. For those of us who have some older children, so.
Sorry, Lisa.
Yeah, I wish that was so, that, you know, that the hardest part was when they're babies, but it's not true. Yeah, especially when you get challenged. You go, are you the one that I carried?
There's no way.
Yeah. Okay, so in the grief work, that's when moms need to give up the idea of who they were before, you know, and sometimes that can be hard for them, and it can be grief for them. So for some people, it may not feel like grief, but there is the giving up of who we were. Before kids, for me, was, you know, I was a different person. I was, you know, I could go wherever I wanted, when I wanted, and I don't think I ever got that back again. So, and then I'm still waiting for a grandchild. That's my one thing. So you let go of your expectations. You know, again, this is of people that are well-adjusted of their self and their infant. They review who their old self was and what was hoped for. They need to be able to grieve in order to be able to move on and to really take hold in becoming this mom. And it really can be difficult when the temperament of the baby is difficult for them, depending on, you know, where they are. And they need to redefine their role with their partner and other children. We can go on. So this is, you know, taking that, and I said to my colleagues at our program, I said, we need to write an article, you know, so that we can have something for people that are trying to help moms. So how can you help moms through this period? So the taking in phase, that's the time really to focus on what was her birth experience like. Help her with the grief work, her disappointment, her resentment that she may feel. Help her fill in the missing pieces. Sometimes things are moving so quickly For any of you, were there like missing pieces in your birth stories that you needed some filling in that you didn't remember? Yeah. So that really can happen where sometimes things happen so quickly. And sometimes moms are so afraid that something terrible is going to happen to them that they just kind of disappear. I did a home birth once of somebody having her 13th baby. She did not tell me what her worst fear was, which was this baby she was going to die. Because she told me if she told me that I would never have agreed to a home birth, and she's absolutely right. So she had her 12 children in bed with her. It was a big bed. It was a huge bed. Not a Jewish woman. So it was 12 kids and her husband all in this bed with her. And she's giving birth, and I'm thinking, everything's going fine. 13 should be fine, although there can be some surprises at that time. So she had a California King with steps. So when it came time to push, I asked her to come over to the steps. We kept the other kids shielded so they didn't really see much, but she wanted them around her. That was her thing. And so she's pushing, and then all of a sudden, she's gone. Completely out.
The mother?
Yeah. Like out.
She fainted?
I had never, ever seen. I never saw it since then, and this was the only time I ever saw it. And I was flummoxed. I was like, what is going on here? Her husband picked her up by her nightgown, and he smacked her in the face, and he said, "You will not do this." And she came back.
She passed out?
Yeah. So I delivered the baby, and then I said, okay, we have to stop. What just happened here? So he said, she didn't want to tell you. She thought she was going to die.
And she acted it out?
She was so afraid she was going to die. She passed out.
She was anxious about it.
Yeah.
That's what caused her to pass out.
Yeah. It was the most frightening birth for me because I had no idea what was happening at that point. But you know what she said to me? She said the more children that she had, the more lucky she felt. And she felt that her luck was going to change. Anyway, so when we get to
bad luck, right? Luck was going to change.
That's crazy.
she just felt that this was the one that she was absolutely going to die. It didn't happen. Anyway, this was a birth that we had to talk about missing pieces because she was so anxious.
It's also traumatic.
Yeah.
For after. No, for you, yeah, but
For you,
for after.
Yeah, for me. What about me? What's
For after, that's a very traumatic, that's a, shoot, I would think someone would have post-traumatic.
No, actually,
Husband like whack, I don't know, just the whole thing's very traumatic.
she doesn't remember that. She just came back. I mean, her kids saw it.
Did they knew what was going on? Like they.
Well, they had, each one of them had been for the birth of the next child. So it was just something that they did in their family. But, you know, I almost had heart failure at that point. And, you know, we had to debrief.
It could affect how those girls birth later.
Who knows at this point? So I didn't get to deliver the next generation. So women need to debrief. They need to hear about the missing pieces. Sometimes, I think I remember going through infertility at one point, and I had some crazy medication. And I heard this woman screaming and kicking this doctor, and I thought, oh, what an awful woman she is. It was me. I had no idea, and so my husband filled that in for me. So, but anyway, no matter what the story is, you know, you're there to hold them, to support them, and to have them talk about their stories and help her normalize embarrassing moments in the birth experience. So the worst thing, especially for first-time moms, you know, they would have a bowel movement. And it happened 9 times out of 10. And in fact, I don't even remember if it never happened. You know, it seemed like it happened all the time. And women were mortified. Like, how can this be? You know, I'm on display, it's, you know, and everybody can see this, it's terrible. So even if they have the most wonderful birth, when that happens, especially with a first-time mom, you know, the whole thing of just holding their privacy is just so difficult. And they just need support and be able to walk through that this is what every woman goes through, and this is why we're so strong. So, I think. and help her verbalize her fears. We can go to the next. Encourage her to talk to others as she feels comfortable. Again, in Lakewood, it was really difficult. A lot of women did not want to share their birth experiences. To sleep when the baby sleeps and the partner. The best sleep, just so you know, is 10 p.m. to 2 a.m. Why? Because we have
10 to 12 or 10 to 2?
10 p.m. to 2 a.m. Why is that important? Because in that time is when you get your slow wave sleep. That's the repair sleep. So if you can get moms to sleep at least between 10 p.m. and 2 a.m., they will feel much better than if they have to stay up during that time, because that's when they get the sleep that helps to repair them. They really should limit their naps to 30 to 45 minutes, because once a woman takes a nap longer than an hour, usually they feel very fuzzy. But power naps can be very helpful, and help her normalize that she's going to feel this wave of emotions. 85% of women have postpartum blues. So we can go on. Okay, now you see how we kind of switch to that kind of taking hold. So you have to help mom to anticipate the reality of being home with the baby. The night feedings, normalize the infant crying, that intimacy can be interrupted. This is just, to let them know. In Lakewood, I remember husbands would get 1 hour of instruction of what to do on the wedding night. And I really felt that there wasn't much instruction in terms of what do you do at these times. So these are times that you can fill in, how this is going to be for them. The other thing is that moms can call a postpartum unit 24/7 and ask a question, which is great. And nurses are happy to do that. I would get calls sometimes at 3 o'clock in the morning of a really distressed mom. She doesn't want to wake other people up. She needs help with diapering and bathing and breastfeeding, learning the baby cues, and then also finding out who's going to support her. What I find is the moms in my program, a lot of them don't have any support at all. By 2 days postpartum, they're on their own and have nobody. It's very, very sad. So that's the time that you want to model her. It's better to do live than video. So when we talk about Facebook, forget the YouTube. They really need to see what you do. Point out the strengths. We really want it to come from a strength-based. Like, wow, that was such a great thing you did. It was so amazing. She needs to know that. And that she's supporting her growth and development, and that it's okay. Babies are very resilient when you make mistakes. I remember talking to my children and just saying, you know what, I'm going to get this, especially with my daughter, the oldest, I'm going to get this diapering thing down soon. It's just difficult to do. And we decided we were going to do cloth diapers with the pins. Why I decided to do that, I don't know. But I wanted to be a natural mom, that really did it like, the old country. So it takes time to get to know a baby. Sometimes it takes time to fall in love with the baby. It really does. So if a mom's not in love with her baby right away, that's okay too, and we need to reassure her that's okay. And then some babies and some moms need more time. So we can go. It's good to have a sense of humor. When I was with this mom on her 3rd postpartum day and she's breastfeeding and her child is taking out every single book out of the bookcase, she could laugh or she could get very upset. But sometimes it's just like, what am I supposed to do? This is a time to help her explore her baby and look at the baby face to face, especially if she doesn't get it. So again, we don't come with a set of instructions. We don't necessarily have a maternal instinct. And to set realistic goals. How do you handle visitors? Okay. This woman that had psychosis was talking about how she was in the hospital and her father-in-law came in and she wasn't dressed. It was just so upsetting to her, and she had no ability to say, get out. It was really, really difficult. So helping moms to understand that, sometimes you have to have your husband speak up for you and say, you know what, she really, let's just wait, or maybe tell the nurse that if a visitor comes, make sure that she feels dressed and ready before you let somebody in. Sometimes they'll put a sign on the door.
I think that also a lot of people don't realize that the nurse can put a sign on the door. for them. Like, I remember the first time I had a baby and I was like, I told the nurse, like, I can't deal with this. This med student comes in at 5, this resident comes in at 6, and then like finally the OBGYN comes in at 7, and I just sent the baby to the nursery, now I have to feed them. She's like, oh, do you want me to put a note on your door that
Yeah, and they
no
can do that.
students or residents should come in before 7? I was like, yes. And I did that with like all my kids after, and I was in the hospital for 5 days, so.
Very
makes a big
enlightened
difference.
nurse, very enlightened
Yeah.
nurse. So this is very important.
And
So, letting them know that they can make a decision about visitors. She felt that she couldn't say anything. She was actually revving up for this psychosis, but she was saying these are the things that really upset her. And she didn't want to see her mother-in-law then either. She wanted to be dressed, she wanted to look better. Yes?
It's like when you want to ask people to clean their hands. But if it's a friend, that's one thing. But like a family member comes in and you sort of don't know how to say to them, like, you can't touch my baby until you clean your hands.
Mm-hmm. And you feel kind of guilty. But at the same time, women need to know that they need to feel comfortable to do that. And there are ways of saying it graciously, just, I would really appreciate if you wash your hands, and it's very important to me with this baby. I remember I want to say it was the 3rd postpartum day. My daughter, my sister-in-law, who's a wonderful person, she had this big cold sore on her face. And before I could even grab my daughter, she had kissed her. I was so angry. And you know what? She got the cold sore, the same thing. And I was so angry. But, it's with the first baby, it's really hard sometimes to just say, I need these boundaries. But these are things that you can help moms with, that they can make the boundaries, especially if they're prepared. And I don't think that they really talk about this in childbirth classes. And again, are moms ready for that?
I was just going to say, like, there's very little preparation for what's going to happen after you have the baby.
Right, it's all up to the birth.
And it seems, I don't know, maybe there's a reason for that, like, because it's all you can handle, it's just having the baby, but just a little bit of it.
I think the birthing classes are like a medical perspective. Like, this is what's physically going to happen to your body, and like, here we're talking about like a totally different angle.
Right, I think also, like, if you think about it, it also depends on who modeled it for you. So if you were, I was the oldest, so I saw my mother having the babies and saw how she handled the postpartum. My mother would never let anybody visit her in the hospital. So I had that as a role model. So I made it very clear, do not come visit me in the hospital. And then there would be like the doctor who was on staff who also happened to be friends who just decided that he had to come visit me in the hospital. But like, that really annoyed me actually, and I take them
Because
out.
it's crossing
But
boundaries.
It is.
Yeah.
But I think that it's a matter of who models that postpartum experience for us. Some of us don't have models.
Well, I was given like very kind of vague, like, and it's going to be very hard. And if you don't get along with your mother-in-law, you don't want her there right away. And I was just like, but she's flying in from America. Like, what am I going to do? Send her packing.
And I experienced something very different because I used midwives as opposed to OBGYNs. And the midwives prep you in your 9th month, what's going to happen, what's your plan. I mean, it wasn't like you have the baby and we're done. It's like, you have to think about having the baby. We talked about that for the past 8 months. Now we need to talk about what's happening.
And it's true that midwives do that.
Yeah.
So I did this with my patients as well. But the vast majority of women who deliver with OBGYNs do not get this kind of instruction at all.
I also had midwives with my kids, and while it was like really awesome prenatal care, and we did talk about what happens afterwards, it was still like a gigantic surprise.
Absolutely.
Really, you just don't know unless you have been around other people who've had babies, and
even then,
actually been
it's
around
different
them
once
all
you're
the time, which nobody is. Right, exactly.
I think I remember going to a store to get clothes, like maybe when my daughter was maybe 3-4 months old or something like that. And there was a young girl who was, there, and she said, "Oh, you have such a gorgeous baby. This must be like the best thing for you in the world." And I said, 99% of the time, it's a wonderful thing. And this is what I said, and she was so upset with me. And so I said, some days I feel like I want to flush her down the toilet. And she looked at me like I was the worst possible human being in the world. And I thought, you have not had a child that is trying your nerves at times. So, and this was the first time that I really could get out and do anything. But, yeah.
Someone needs to step up to the plate. They're like, maybe we should be visiting them before.
I think this is important.
That's something we should talk about.
Yeah. So these are some other suggestions also, putting visitors to work. Getting up at night, letting the baby cry, keeping logs, trying to identify the different type of crying patterns, to teach caregivers how to do what they need them to do. Only do things that are necessary, outsource to others. They could have a meal delivery service, they could have a night nurse, Bikur Cholim, you know. So we can go on. And then the letting go phase, it's then she needs to think about what she's going to be also as a wife, you know, not just as a mother. So the first is for herself, the second is more focused on the baby. Now she's thinking about her partner. Does she need help? What are the issues? Plan time for intimacy, to talk about dividing responsibilities, planning time away. Sometimes people can have a date in their own home. You know, they set up some candles and they can do some things. Maybe do exercise, having a DVD, thinking about how they can kind of return to that new normal. The new moms groups, and then involving older kids in baby care with smaller jobs that they can handle, like getting diapers, pushing a stroller, putting the books back in the bookcase. Let's go on. How does she plan meals and healthy snacks, that it's okay for a messy house? That she can clean in 15-minute bursts, avoid major life changes, just tell her it doesn't last forever, and referral to psychiatric professionals if they're having a difficulty making a transition. So let's go on. So I wanted to talk to you, if I have maybe like 5 minutes or so.
5 minutes, yeah.
Okay. So I wanted to talk to you about what we can offer. You know, if you have a mom that's really struggling with a psychiatric problem. A lot of the women in our group are mothers like you. They understand things and they really help moms quite a bit. So psychotherapy, we have this Mother-Baby Connections program at Drexel, and then I do prescribe medications as well for moms. And most of the medications are safe, by the way. A lot of people think they're not.
Outpatient is multiple times a week?
2 times a week.
For what's the
Wednesdays and
length of time?
About 4 hours they spend. So we try to do about maybe 4 therapies a day.
And
So
they bring the baby with them.
Yeah, we want them to bring the baby. Again, we're modeling on something that happens in Europe. So keep going. Okay, other way. Yeah, there we go. Ooh, okay. So we try to decrease the isolation and shame and provide a structured setting. So it's not just regular therapy. This is very intensive therapy that they're getting.
Is the day program different than the IOP?
Same, it's the same. So the main thing is that they can return at home at night. And where they go into the hospital in the UK, they can go back to home. And we get a very realistic gauge by how they're working in groups with each other. We also do some surveys to see whether they're getting better or not. Are they functioning better as a mother? Are they having less depressive episodes? It's very cost effective. Okay, so we can keep going. I think this is because it's another presentation. This is a mom that was very depressed, and she wanted people to see what postpartum depression looked like. She's from Australia. So we saw that there was a need. There was nothing in Philadelphia closer than Rhode Island for intensive mental health care services for moms. This is very different than just seeing a therapist, so it's way more than that. So they may prevent their hospitalization, could be a step down, and it helps them to connect with other women's health services. Again, we have to deal with the stigma. We can go to the next slide. We have a lot of people involved in this. Nursing, psychology, we have couples and family therapists, we do creative arts and physical therapy, and eventually we're going to get nutrition involved. I'm doing the prescribing right now. We're actually going to be getting some child and adolescent psychiatric fellows coming in to prescribe as well, so we can keep going. We have 2 nurses, a psychologist, a physical therapist that run the program, and we have individual couple and group therapies for 2 days a week. And then we also have therapies by graduate students that are PhD students. So they're from nursing, psychology, couples and family therapy, physical therapy, and creative arts. And we keep going because I promised you 5 minutes. So this is our team. We can keep going. We have a lot of people. Life Cycle Woman Care used to be the Bryn Mawr Birth Center. So we have Women's Care at Drexel. There's a 11th Street Family Center, St. Christopher's Hospital, Women and Infants, Northwest Human Services, Nurse Family Partnership. A lot of the hospitals, the web, people will self-refer as well. And it's very easy to get a hold of me. I think Devora has all that information. So I do call the moms back. And we're trying to improve mental health. And then we're also trying to train providers. Keep going. So we're trying to give access to this type of care, help them with depression, and the important thing is we're going to try to help them with mother-infant interaction, because that's going to be a key in terms of helping them feel better, that they're more confident in themselves, and to reduce stigma and increase knowledge about that. We can go to the next one. We want to educate families, and I told you about training people and developing partnerships with community providers such as yourselves. And we also do some research to find out what's going to help moms the most, and we can keep going. So these are all the therapies that we do, and I don't think I'm going to have time to go through all of them, but interpersonal therapy teaches women how to deal with a difficult mother-in-law, how to graciously ask for what she needs without getting the mother-in-law upset with her. Okay, so we give them skills in a group format. Cognitive behavioral therapy. That's when moms have thoughts like, I'm a terrible mom. So we help them deal with their thoughts and change their thoughts. We do some work with trauma, with PTSD. We have this mother-baby interaction session with physical therapists that check the babies out, and couples therapy and dance movement therapy, and we also have a wellness group where we do some education. So I'm not going to go through all of the all of the different therapies, but I just wanted to make you aware that we are out there, that we do want to help, that we have backgrounds as mothers. As you know, I'm a midwife and a psychiatric nurse practitioner, and we have physical therapists who can see whether moms are helping the babies develop in the way that they want. So we're here to support, and so that's really all I have to say. And I hope you enjoyed this.
Thank you. I will get the slides and forward it on to the team so that everybody can have a copy of that. If anybody needs to go, we understand, go ahead. Our next workshop is going to be, it's January 11th.